Kidneys are a pair of excretory organs situated on posterior abdominal wall. They are present one on each side of the vertebral column behind the peritoneum. They remove waste products of metabolism and excess water and salts from blood, and they help in maintaining the pH. Functions of kidney are: 1. Purification of blood by ultrafiltration and removal of metabolic waste products. 2. They conserve body fluids, electrolytes, and maintain their balance. 3 is they also perform several endocrine functions. First one is they produce erythropoietin, which helps in formation of RBC, and renin, which converts angiotensinogen into angiotensin. Renin helps in BP regulation. Vitamin D3. Length of kidney is 11 centimeters. Breadth of kidney is 6 centimeters. And its weight is around 150 grams in male and 135 grams in female. Usually, kidney is lobulated, around 12 lobules are present in the newborn, but in adult, the surface is smooth due to the fusion of all the lobes. External features of kidney. So, kidney lies opposite to T12 and L3 vertebra. Kidney has two poles, two borders, two surfaces. The two poles of kidney are the superior pole and inferior pole. Superior pole is broad and it is in close contact with the corresponding suprarenal gland, but the inferior pole is pointed. It has two borders, which is lateral border and medial border. Lateral border is convex, but the medial border is concave, and in the middle part of the medial border, it shows a depression, which is nothing but the hilum. Kidney has two surfaces, anterior surface and posterior surface. Anterior surface of kidney is irregular, posterior surface is flat. Coming to the hilum of kidney, so following structures are seen in the hilum of kidney from anterior to posterior side. You find renal vein, renal artery, and then the renal pelvis. So kidney moves vertically about 2.5 centimeters during the respiration because the upper part of posterior surface is related to diaphragm. Coming to the relations of kidney. So kidney is a retroperitoneal organ. It is covered anteriorly by parietal peritoneum, and anterior relations of kidney are right and left. So right kidney has its anterior relations, left kidney has its anterior relations. Coming to the right kidney's anterior relations. Right suprarenal gland, right lobe of liver, second part of duodenum, hepatic flexure, and jejunum. Coming to the anterior relations of the left kidney. Left suprarenal gland, spleen, stomach, pancreas, splenic flexure, and jejunum. So, anterior relations of left kidney and right kidney differ, but the posterior relations of both the kidneys are same except the 11th rib. 11th rib is a posterior relation for the left kidney, and then all the relations, which is 12th rib, the four muscles, which is diaphragm, quadratus lumboris, psoas major, transversus abdominis, nerves emerging from the lateral border of psoas major, from above downwards, which is subcostal, iliohypogastric, ilioinguinal, and subcostal vessels. All these posterior relations are common for both right as well as the left kidney. Coming to the coverings of kidney. So there are four coverings, which is fibrous capsule, perirenal fat, renal fascia, and pararenal fascia. So this is kidney, and then the green one is perirenal fat, red is renal fascia, pink is pararenal fat, and blue is renal capsule. So coming to fibrous capsule is a thin membrane. It is closely investing the kidney and it lines the renal sinus, and fibrous capsule can be easily stripped off from the kidney. Perirenal fat is fibrous tissue. It lies outside the fibrous capsule. Renal fascia is dense. It is elastic connective tissue. It covers the kidney. And pararenal fat, it has two layers, anterior layer and posterior layer. Pararenal fat is nothing but variable amount of fat lying outside the renal fascia. It is more abundant posteriorly towards the lower pole. It fills up the paravertebral gutters and it forms a cushion for the kidney. Coming to the blood supply. Each kidney is supplied by renal artery arising from abdominal aorta. Usually the single renal artery arising from the each kidney. You can find renal artery here. And each kidney is drained by renal vein into inferior vena cava. This is renal vein, this is renal artery. And then lymphatic drainage of kidney. Lymphatic drainage is into the lateral aortic nodes. You can find the lateral aortic nodes here. The lateral aortic nodes are located at L2 vertebra. And then the nerve supply. Nerve supply of kidney is by renal plexus. It is an offshoot of celiac plexus and it contains sympathetic, which is from T10 to L1, which is vasomotor, and afferent nerves of kidney belong to the segments T10 to T12. This is the nerve supply of kidney.